Hi, good morning from Austin, Texas. We're here at the COS meeting with Dr. Sumitra Khandelwal. Good morning, Sumitra. Thanks a lot for being with us.
Great. Thanks for having me. Appreciate it.
Sumitra, it's always a pleasure. And today I want to focus specifically on treating inflammation, treating ophthalmic inflammation. You know, as a cornea and cataract surgeon myself, one of the big games that we play every day is trying to address inflammation. And so there's a lot of different ways we can do this and a lot of different steroids that are available now. I'm wondering if you can walk us through the various different options we have for steroids for treating inflammation, including how you feel brands versus generic play into each other and what kind of treatments you find effective for your patients.
Well, you know, I've done a little bit of like a boomerang back and forth. Obviously, when you're in training as a resident or fellow, you have very little exposure to brand names. You're oftentimes used to using those that are within your formulary. And so, you know, starting out, you know, there was nothing really wrong with generics. There's definitely a little bit of for generic pred-acetate, for example, there's definitely a little bit of a compliance. You have to shake it, for example. There is the issue that you're not quite sure what's in the suspension itself. So we did have some patients that had a little bit of dryness with some of the generic drops post-cataract surgery or PEs. In general, they worked okay, though, but then the prices started changing for those as well. And, you know, I think patients want the best outcome now, for example, for cataract surgery. And so I think for that reason, I very quickly switched back to brand name. The issue, of course, is access. I mean, we want medicine to be something where we can choose what's best for our patients, but access and affordability of drops, especially those who have Medicare Part D, for example, that they can't necessarily sample or coupon, those become a big issue. And so for that reason, I think there are a lot of options out there. One thing I'm particularly excited about is that Allergan has brought back Pred Forte, and they actually have an opportunity to do access for Medicare Part D patients. So that when you have a patient that has like Medicare Part D and you say, okay, I want you to have a steroid. We used to write, you know, whatever steroid we wanted, and then can substitute pred-acetate, can substitute this, can substitute that. And the patients would still come back and say pred-acetate is $85, $90. So this new program for them, Pred Forte, is something I think everybody knows. Everyone's used it in residency and fellowship and training and for years. It's just a way for us to get access to another steroid, one that I think a lot of surgeons and a lot of comprehensive ophthalmologists and a lot of optometrists are very used to.
Yeah, that's a really great point. Pred Forte is certainly a long-standing and well-known treatment for inflammation, and a lot of surgeons have used it at some point in their career. I'm wondering if you can tell us a little bit more about the access program and how it works from a patient perspective and from a provider perspective. What's involved? Is it an online system? Is it a form to fill out? How does that work?
Well, you know, we always joke around, my technician, she thinks we need a goodie bag for our patients post-cataract surgery, because between samples and like the multiple coupons, one for their antibiotic, one for their steroid, one for their NSAID, you know, they have a lot of paperwork when they leave, and not any of it has to do with cataract surgery itself. It actually has to do with all the postoperative care. And so with this, one of the nice things, you can actually just go online. You can go to the website, and the little card just says what the website is, and then that's how they get their ability to get that coupon access. And you know, there's a pay as little, a pay as much, as more, and so they're able to access that and at least have a predictability of how much it's going to cost them when they go to their pharmacy.
Yeah, that's a really great point. And one final question, Sumitra. I find that sometimes I'll really specifically need to use the brand Pred Forte for a specific scenario, and the generic just won't do, especially in post-transplant patients who are really kind of temperamental on rejection and inflammation. Yet sometimes with various insurance companies, it becomes like kind of a battle about getting that medication approved. Are there any specific suggestions that you may have about how this program may help to kind of fill that gap?
Yeah, and I think one of the keys is that with our EMR systems, it's very important to delineate brand name required on there. I think we used to do that with prescriptions, and there'd be a little prescription pad, and you click the whole brand name. But that's usually on your EMR system too. So you want to make sure that's very specific. Once you put that in, the pharmacy really is obligated to fill it. The other thing is, I always tell patients, like I see them for pre-op, and I say, get your drops today. I know your surgery is not for a week, but I want you to get them today, because your pharmacy may not have the drop that I would like you to use for cataract surgery. They may not have it on the shelf necessarily, especially in smaller pharmacies and such. But this gives your pharmacy 2 to 3 days to get it, as opposed to coming the day before surgery, getting their drops, maybe even the day of surgery, and then not being able to get that, and then coming, the day of the post-op day and saying, hey, I don't have my drops. Well, there's not much we can do about it then. We can sample for a couple of days, but really planning ahead for these is the best.
Yeah, it's nice that the patients and the pharmacist can have some time to flesh out any nuanced details that need to be addressed. Sumitra, this has been a great discussion this morning for us about the differences among various steroids that you can use in treating ocular inflammation. Thank you so much for sharing your expertise today, and it's wonderful to hear about this program that you've described.
Yeah, great. Thanks for having me. Appreciate it.